The free at-home COVID test kits paid for by the government will soon be getting to Valley homes, and healthcare specialists say it's important to understand their limitations. Channel 5's Cassandra Garcia caught up with the Hidalgo County Health Authority.
Good afternoon, Gina. There's a lot to love about these at-home test kits. I mean, they're quicker, easier, no lines, and you don't even have to leave the house. They're really a great resource to have, but they're not perfect. So one local health official says you may have to retest. All government-issued at-home COVID test kits are rapid antigen tests. That means samples don't need to be tested in a lab like a PCR, and results take minutes. But there's a downside.
You can have up to 15% of a false negative test. That means that you can actually have the disease and the test negative.
The antigen test looks for specific antigen proteins found on a COVID-19 virus. And when those proteins react with the antibodies on the test strip, the result is positive.
The problem is you may not have enough of it. And so you may not be putting enough of a substrate to react. And that is why it doesn't compare to the gold standard.
Dr. Ivan Melendez recommends testing 2 to 3 days after exposure for more accurate results.
So if you test 3 days later and you're negative, I'm saying beware. What I mean by beware means retest in 2 days.
And if you feel symptoms but test negative, he says to isolate until you've tested negative more than twice, with a couple days between tests.
If you have symptoms, you have to assume that you have the disease, retest the next day or 2 days later, isolate in the meantime, or go get a PCR test.
And if your at-home test is positive, he says there's no need to retest or get a PCR because positive results are typically accurate. Dr. Melendez believes at-home COVID tests make a great screening tool, but he says you should never use them as a definitive test. In McAllen, Cassandra Garcia, Channel 5 News at noon.